Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in this Ayurveda in GP series. I would like to welcome you all. This is my Ayurveda Academy channel, and you can make paid online consultation by WhatsApp on 92268 My dear friends, today I'm going to discuss something about palpitation. Palpitation means the person can hear his or her own heart sounds. Lup, dup, lup, dup. Actually, normally, when we are moving around, we don't feel that we have the heart. We don't feel that we have the head. We don't feel that we have the liver. But these organs, when they are in a pathological state, they make you understand that, yes, I am here. Yes, I am here. Yes, I am having in the abdomen, liver. So whenever there is a pain in abdomen, you can understand we have some organs in the abdomen. When we have the severe headache, then we understand, yes, we have the head and brain for thinking purpose and proper utilization. And then when heart sounds starts hearing by the patient himself or the person himself, that condition is called as a palpitation. 80-90% the cause is more psychological of nature or the physiological. For example, if you run a lot, then automatically your heartbeat increases, which is called as a tachycardia, and by that tachycardia, automatically the patient is aware of his or her heart sounds. Another thing, this is but in pathological condition, which is called as a ventricular arrhythmia, regularity, lup, dup, lup, dup, this regularity goes away, and then that is a pathological, that is called as a palpitation. Even in hyperthyroidism, thyroid gland the problem, then there also one of the complaint is palpitation because of the increase in the basal metabolic rate. But 80-90% the causes are stress, tensions, and psychological causes. Let us talk about the causes, then what type of investigations we can do, and what type of Ayurvedic management we can give for the palpitation treatment. So etiology means the causes. First, cardiac causes, non-cardiac causes, and non-organic diseases. One by one, we will try to concentrate, but you have to see these different causes to make the focus on this particular information. Cardiac heart problems like extrasystole, paroxysmal intermittent tachycardia. Tachy means normal heart rate is 80 per minute, 80 per minute. If it is more than 100, more than 110 per minute, then it is called as a tachycardia. Then atrial flutter, then fibrillation. These are the abnormalities in the cardiac rhythmicity. Then heart block. You know the heart is working on the electrical circuit. So whenever SA node, AV node, bundle office, right bundle branch, left, I know, my dear friends, some of the person will say, sir, this is all medical knowledge. Yes, I know. But to get a general knowledge, you can listen carefully this video because you are getting the treatment at the last. Okay, hypertension is one of the cause, and aortic regurgitation, getting the blood back because of valvular defect. Non-cardiac causes, the heart is not the cause. That is Effort syndrome. Just now I have explained after running. Then flatulence, indigestion, gas in the stomach, pressure on the pressure on the chest, pressure on the heart, that can cause the arrhythmia, especially gallbladder dyspepsia. Dyspepsia is improper digestion. Then anemic condition, remember this. So whenever you have the palpitation complaint, immediately go to the laboratory and test your blood for anemia. Hemoglobin normal 12 to 14 gram percent. If it is below 10 gram percent, you have to treat the anemia. Then automatically palpitation will go away. Pulmonary tuberculosis, thyrotoxicosis, embarrassment of the heart due to the local pressure like pleural effusion, that is a tubercular infection, pneumothorax, tympanitis, ascites, fluid in the peritoneal cavity, that is in Ayurveda it is called as Udara Vyadhi, and also pregnancy, that is giving the pressure on the heart or pressure on the chest. Then non-organic diseases, that is after violent exertion or emotional upset, especially in the sensitive individuals, convalescence from a debilitating disease, like for example, long-term fever was there, like because of the typhoid or pyrexia of unknown origin, or you had a jaundice, and very weakness is there, then you can get palpitation. Excessive smoking, vasoconstriction, nicotine, then tea, coffee, or alcohol, and functional cardiac arrhythmias, anxiety, and neurosis are the major causes. Now let us see what we can do as a investigations. First thing you have to do the hemogram, that is hemoglobin, red blood cell, white blood cell, etc. And ESR, erythrocyte sedimentation rate to rule out or to check the prognosis of chronic diseases, especially rheumatoid arthritis and tuberculosis. ESR is important. Okay, then anemia, less hemoglobin, acute or chronic infection by checking the white blood cell count, because white blood cells are soldiers in our body. Okay, X-ray, PAVU to rule out the lung pathology like tuberculosis or pleurisy. ECG, electrocardiogram to rule out the cardiac pathology or problems. Urine for pregnancy test. Now let us check about the treatment part. First, you have to find out the exact cause and treat that particular. If anemia, treat anemia. If heart problem, treat heart problem. If there is a thyroid problem, treat the thyroid problem. If due to the psychological tension or as a symptomatic treatment, we can prescribe Manas Mitravati, Arya Vaidya Shala Kottakal. Manas Mitravati, the best tablet, one tablet 3 times in a day to remove the anxiety and tensions. Then Allersin company, Siladin tablet, 2 tablets 3 times in a day. Then Shrunga Bhasma to give the support to the cardiac muscles, 250 milligram 3 times in a day with ghee and lukewarm water. Let us move further. Then you can give also this particular treatment, Jawahar Mohra, number 1 tablet 2 times in a day. Then Prabhakar Vati for hypertension, 2 tablets 3 times in a day. Then Swarna Makshi Kadi Vati of Hari Parshuram Aushadhalaya Pharmacy of Khadiwale Vaidya from Pune city, Maharashtra state, 2 tablets 3 times in a day. Then most important is do's and don'ts. The patient must be advised that he should stop smoking, stop alcohol, or rather de-addiction program. Okay, then have a tea and coffee in moderation, avoid overexertion and mental stress, and practice daily shavasana and meditation. And also I will recommend Shirodhara is also useful to remove the anxiety. And one important is a Rudha Basti. Please understand, write down this word, Rudha Basti. Visit our nearby Vaidya and do a specific lubrication treatment on the heart muscles. So my dear friends, this is all about the palpitation complaint and how we can think about it. My dear friends, to get the whole series of Ayurveda in general medical practice in English, please don't forget to subscribe my YouTube channel and press the bell button icon to get the notification of newly interested videos. Thank you very much. I wish all the best. Take care and see you soon.